the health of Botswana is tantamount, is the one that's paramount to productivity, is paramount to any riches. How do you even dig for diamonds when you don't have people who can be
Absolutely. This time we are visiting health. And as you may be aware that during the heydays of HIV/AIDS, Botswana was almost on its knees. Not just Botswana, but Africa at large. And the issue is with HIV/AIDS, with health in general, are we winning as a country? And we couldn't have brought you a better person. But Professor Sheila Dinotshe Tlou. Welcome.
Thank you. We went to Kennedy knows so well. Thank you so much.
Is it possible to have HIV/AIDS free society?
No, I don't think there'll ever be a time when you're saying there's no case. Elimination, when you're talking public health, is where you are saying it is no longer a public health threat. I mean, if you look at HIV now, the way we worked on it, it was now a chronic disease, just like hypertension. So that it now becomes a disease just like hypertension. In fact, when you look at it now, the cost of treating and managing a person living with HIV is far less than managing the person with diabetes and hypertension.
Is it?
Yes, right. Yeah. To me, health is, the utmost condition that is necessary for development. Good health is what no country can do without. If we do not integrate primary healthcare principles, whether it's malaria or TB or HIV elimination, it will not work. We need role models who can role model behavior to our children. HIV is still there. And now we're seeing it rising among young people who don't know what we saw. You see, the thing is, during our time, we were scared because we saw the face of HIV. We saw people being buried.
You saw your cousin, you saw your mother, you saw...
we've seen the devastation where we had no hope. We saw where we now had hope. And we're saying we still can continue with that hope because if we keep it alive, we will eliminate.
Welcome to the GrowthWell Podcast, where we tap into a well of knowledge, innovation, and leadership to fuel Africa's growth. Here, we explore thought-provoking insights and expert knowledge that empower individuals and businesses to thrive across the continent. Whether it's personal development or professional advancement, our conversations inspire action and impact. This is GrowthWell, where ideas flow and growth begins. Let's dive in.
Good. Welcome to GrowthWell Podcast. We are here again, and this time we are visiting health. And as you may be aware that during the heydays of HIV/AIDS, Botswana was almost on its knees. Not just Botswana, but Africa at large. And the issue is with HIV/AIDS, with health in general, are we winning as a country? Is the continent also containing HIV/AIDS? And we couldn't have brought you a better person. But Professor Sheila Dinotshe Tlou. Welcome.
Thank you. We went to Kennedy knows so well. Thank you so much.
Welcome to GrowthWell, Tlou.
Thank you, sir. It's good to be here.
Such a pleasure. In your travels.
In my travels. I call myself the SDG 3.3 lady. They get rid of the epidemics of HIV, of TB, of malaria. It's in the African continent.
And we'll talk about how you are progressing with that.
I plan to fight them until I go into the grave.
All the way.
All the way. Whichever comes first. People they prefer Sheila. It's if you look at how I was named, I was named by my grandparent, Rahomme, almost pateleng.
Ow.
a lwala TB.
A godile.
And that's and that's what eventually took him. Ebile gore o ata go mpona yana ba gana gore kana ngwana nya I insist
yes, to expose you.
Ha taibere gore ga twa mpisa gore o notsi. O di notsi. O tilo go bereka. O tlo go berekela like a honeybee. O tlo go berekela setšhaba gore for the purpose of other people, isn't just your own benefit. So, ya no, ina ele mo go ting ina lebe se rom. So, ha ngwa ki itsa ba go ikutela gore itse re ke gate ba Cameroon ba re ke to gore ke a re ha ke re hey ke akanya monna mogolo
o notsi tota.
Ba gore ai hohe ya Cameroon. Ebe hoha ya Cameroon. Because se nna mo plane and I'm fine in the plane.
Is it?
That's one thing that I love.
Okay. We like starting on a lighter note. I also Dinotshe, if I may, on a lighter note. And I just wanted, I mean, even the spirit at which we started this podcast, I've observed you, you know, we met at the airport the other day, like Tobela, you know, and I've seen you having parties and the spirits. I mean, like you said, at this age where people usually they are, I'm slowing down. But you seem to be up there.
I think
what's going on?
What's going on? All along. No, but you know, I thought how even when I was a minister, I'm one person who has always appreciated life, appreciated human beings in general. But maybe I took it from my parents because my mother was just
outgoing, bubbly.
Who was always
yes.
So you look at that and you're thinking, that's the way life should be. I'm holding all your problems. School fees. So when we had to grow up with that kind of spirit. Happens the spirit of adventure. She was a very adventurous person. She's the one person, I mean, she passed 2 years ago at the age of 96. Me, already she had gone to Israel. She had I'd go with her. And then the third, fourth day, we are partying.
That's fantastic.
So Israel, for example, the first time I Israel, Israel. The second, the third time I UCC.
Okay.
When I was a Catholic, ke tsamaya go Israel ha ke tsena kwa ke bereka but ke arrange all the tours
go Jerusalem
and should come in the evening ya nna khantse ke berekela gore ka moso ke I'm presenting something
yes.
Ba re ngwana ka me ke go bela go setsene I've been to Nazareth twice already. You didn't see it through my eyes. Make it through my eyes. And I would do that. So as a result, adventure. That's why in my old age, I'm now into cruising. I've always liked.
That's why I saw that when you went into cruises. Yes.
So for my birthday, my children were about Mary, you know, for your 70th birthday, Mary who organizes a cruise or a cruising. You can make a check out where can they give us a discount.
Yes. If you come in numbers. Yeah.
The officer there, we can only give you if it's 12 cabins. Okay. 12 You know what happened? I'm coming to pay for the first 30 cabins. By the time I had we had 110 cabins. And but were 300.
Wow, for
300. Celebrate birthday ya ga Sheila Dinotshe. Ba ngwe le go iba itse ke sa ba itse. Ile mo go teng ke kopa o mo ke kopa gore ke join go ta go iwa sekepeng ke go celebrate ke join ke ba ke ga se sekepe sa me. You just pay me ke batla gore part of the group. We had such a good time. I had earned enough enemies.
Those who didn't go.
Who didn't go and who pretend that they never heard of it. So last year, Yeah, like this year, like March, we went on another cruise. I'm from Cape Town, go Walvis Bay. Yes. No. Now I enjoyed it more than my own birthday. It doesn't matter. The thing is, we had fun. It was so good. And manabibi abare metse ko guitar di minister di mo go Sheila rota le batho ba le 300 baluko ile go le bana ba go launch ka they were launching the International Desert Festival for the first time in Namibia. I did doing sing highly.
It was beautiful.
Most of the ministers were. It was so great. We had a good time. So Caribbean.
Wonderful.
For 2027. I get next year.
2027. It
will become March 2027.
That's nice.
From Miami into the Caribbean.
Yes. Florida. Actually some jazz ones around that area.
The good part about this one is that it's the largest ship in the world.
Is it?
3 times the size of the Titanic. And this one will not sink.
It's not sinkable.
This one is so sinkable.
Titanic was not supposed to be.
I know.
Yeah, it was be careful.
Right now, we are so excited. We're taking Emirates to Miami and then back. Basalanko Dubai, Basalanko Miami, Disney World. We want to have fun.
Absolute fun.
For while we are alive, COVID has taught us that life
is too short. Life is too short.
We can't take it for granted. HIV didn't teach us that. HIV did teach us that we need to be together. COVID so we need to really in the ultimate, we have to thank God for our existence and where we are able to celebrate.
No, you are living the spirit. I don't know if you've watched some of my podcasts talking about the importance of happiness and actually working on it. Be intentional about it. Stop whinging about that. Take it under your control.
And the good part was I was married to somebody like that. Reto was, he was all for it. We traveled all over. Mumiro Setswana hello ijela mphalishi le nama ibereka Friday abaja phalishi le phani alo sa ba phalishi le phani ka Friday ona tsena ba batho nase ga go la bokai nase a go Friday ure ke no phani me potso ha a re sort Hara Victoria Falls we go. Sometimes I wish he was here. He would really have loved
enjoy with you.
I was on a cruise with him only once. The crosser from Sweden to Norway. But I usually just think, I wonder how we have kept, felt now. When I don't know where now gombo mu church. Wabo jaile bana baba tu ba ise kaka. What
Mirwa.
Ona rata sibura ta.
Ibila sibua to taka samallo.
Go ga ino go bua sone he.
Oh, beautiful.
Me ha sibua. La ka wa shaketse ne re tshega. Because wa go hela kana sibura se ya ka se.
Yes, so le tswa ponyana ka bofaniana jwa teng.
Wa tshega.
I also do note, some of our viewers don't know you. And let me just introduce a little bit in terms of you being a former minister. We were chatting earlier about some of the interactions with Rakama, Remochai and all that. Some of them, I don't know whether you want to share here, but you're a former minister at 2004. In your term, when I went through your profile, such achievements. Including, in terms of HIV/AIDS transmission, mother to child, all sorts of statistics, maternal mortality due to AIDS decreasing in a big way, achieving near universal ARVs. That was one of the most really profound things. And Botswana is also renowned for prevention of PMTC, prevention of mother to child transmission, which was a big thing. But otherwise, You chaired the SADC and African Union Ministers of Health during your minister time. You also served as a UNAIDS Regional Director for East and Southern Africa, where you're responsible for 21 countries. Africa, I'm sure let's Swahili but what I see in you is more on the advocate. Sometimes these are just positions, but it depends on your agenda, isn't it? My agenda is from being a nurse, from a health, basic health, and then from the child to gender. Used to now we say gender. Gender. And then your awards. I mean, I've never seen somebody with so many awards. And I'm not going to go through all of them. But you've received national and international, just starting from home in Botswana. You received the Botswana Presidential Order 2002. And then obviously being a nurse, Florence Nightingale Medal, 2003. You're seen as a trailblazer, Women Leading Change Award, YWCA, Leadership in Health Award, Global Business Council in Health, and then Princess Sringagrinda Award, Thailand.
Sinakurin. It's Sinakurin Award. That was really one of the special ones for me. Because that award is named after the mother of the king of Thailand. So I had to be invited there, go and spend 10 days in Thailand. And they said, bring somebody. And my daughter said, can I come with you?
Yes. You took your mother.
I took my mother. Hey, I say to Bella.
Oh, shame.
I say kids. Was I one? Dikolo itse diemela wena ke re diemela nna dikolo itse Thailand di a go itse
go Bangkok
it was so beautiful and it was given by the princess. The king was sick in hospital. He later passed away, but I had to visit him and go inside, and I had to go with my mother. The television cameras the prince. Once you are given that award, you actually become
everything's
you become the princess. I am a princess of Thailand. And I get my visa within an hour. And I get there.
By the way, you look like a princess the way you are dressed up. You look beautiful.
Yeah.
You look really nice.
Purple. Royalty. Purple. So like it's award purple. Make it not we're not representable. Not royal. So anyway,
and then the Presidential Award for Outstanding Contribution to Global Health. That's in America Academy of Nursing. A lot of them, Bangkok. It was to do recognition in nursing and midwifery, which is quite core to your qualifications. But the special one gave these honorary doctorates. Including the Dillard, I don't know if it's pronounced proper, Dillard University 2014, University of Connecticut. The Humane Letters.
Doctor of Humane Letters.
That's one I want you to just touch on. Why was it so special, that one?
The special one actually was the Dillard one.
Yes, the Dillard one, yes.
It was conferred also to Michelle Obama. Okay. So we were both graduates.
You all staged together.
We were both graduates. You are having this with Michelle Obama. New Orleans. It was my alma mater. But then it wasn't her alma mater.
Okay.
So because they knew Michelle was coming, they held it at the University of New Orleans, which has a stadium at hold 10,000 people.
Thousands, yes.
So you can imagine Michelle Obama. What Michelle did, never place for not 8 minutes, and not about 10, 12 minutes. So how was the top 4 people, the valedictorians in Nigeria. Michelle. I go security ya ta iphutha dilo sa gagwe ya ba iphutha duanyana sa gagwe a tsama
ga ba mo haga na mabore wa tsama
nne ka mo haga ka sa snapelene ke na snapel se monateleng. But the point ke gore go tswa bare, so Sheila, we should meet. You came to stay to our place twice once. Regional director.
Yes.
We must meet again. And I'm thinking, but then she leaves. kwete ke nna for 10,000
o sala
people.
bono, ya, no.
Go le monate ja. So graduation ya we hela batho ba ne ba ka ne ke invite go te ke go hiwa go let's go for lunch. Anya wa maitsima Nigeria ke ba tabara Adama, we are taking you with us to lunch. You have to go and talk to these children. You have to tell them how you got to be. We want them to be like you one day. And it was all girls. This is a voice, it's greater than it ona. Make it somebody in Lebon. Bampu se we se ka 12 midnight. Homo na Jano gone gore wono o you graduated le Michelle. Ke go ntse go te she's a doctor like Michelle. So I really enjoyed myself.
That's wonderful.
Yeah, Connecticut was immediately, after COVID, I think. It was great. It was great in that, but maybe at least this one was my
alma mater. What does humane letters mean? What does
humane
it
letters
mean?
is really saying that you are doing for humanity what people should be doing.
Okay.
And it's nice because it came after a certain podcast. After President Trump called our countries shithole countries.
Yes.
Also a television station, I give you my data. Yeah, we were about 5 Africans who have done more for the world than Trump. From this whole countries.
Yes, whole countries.
The very first person she went to school Ariana Trump. All he said was, I want to see her. That's nice. Make him hanga kopana linda. So later ke ba UNFPA ba re now that he knows about you. I really say. So then I got that and I thought, okay, at least somebody has seen what,
now with so many years of in the health and the HIV/AIDS, and before we get into detail of those specifics, with your many years, you usually develop almost a philosophical position about the role of good health in a nation, or from your perspective, from a continental point of view. I say this because, quite one thing as people, people don't know what life expectancy 100 years ago. It used to be 30. It went to 40 just 100 years ago. Not too far away, it was 40. And then now, obviously, with developments, we got to about 60. Other countries are about 70. Now, Botswana, with HIV/AIDS, it went down to late 50s, Now it's going back again. If you look at the Human Development Index, if you look at life expectancy and all that. Now, what from a Botswana perspective, then you can go into Africa. What is your position about what can be done, or what is that role, really? Health in a developmental agenda.
To me, health is the utmost condition that is necessary for development. Good health is what no country can do without. It doesn't matter how prosperous you become, but if physical, social, and mental well-being are not taken care of, it just won't happen. So, physical, in terms of, for example, Botswana, we were well known for primary health care. When primary health care came in 1978, Botswana was already implementing those things, where it's just like, let the community be responsible, the community should be involved, take care of maternal and child health, because they knew that a healthy child, a healthy mother would bring, forth us prosperity. So that we saw that happening. And in fact, that was one thing I advocated for. That's still my religion now. I say to people, if we do not integrate primary healthcare principles, whether it's malaria or TB or HIV elimination, it will not work. So you are now also looking at the social health. The social health, we saw how important it is during the AIDS pandemic, when people were being discriminated against. Even in the home, background, there was a stigma associated with HIV, the discrimination, and you saw people being depressed. Right away, it affects even the social and mental health.
The mental state.
Yeah, so that it's basically that we need the social health aspect to be. And I saw that going down as people got into treatment, and you saw that the stigma then went down. Because there was also self-stigmatization, let's face it. Much as sometimes we say stigma, there also the person who has just tested for HIV, who feels, if I go and tell my sister, she's going to say, ooh, so there was that. Yet when you work with them to say, let's tell your sister, and they get accepted. And they get that then, the love that they crave for the support, and you then show that
they
level.
Get better even. It affects your biology. The psychology affects your biology.
It does. So that's why it was important to work with people living with HIV, to say, counsel others, to say, Helen David Ngele. It was more like, now you've accepted yourself.
He's still alive.
He's still alive. Helen David is still alive.
He's still alive.
So you have accepted yourself, counsel others so that they can also accept themselves, because only then can they be able to come forth about and we saw that in Botswana when they were saying nothing for us without us.
Yeah,
the reason why some of us succeeded as ministers was because we worked with them. Half the time it was like, where are they? Let them tell me what I need to do about this. At that time, nobody knew anything about HIV. It was, why is it in trial and error? That's exactly what we were doing.
It was eating away everybody.
It was eating away. There was nothing like
right,
to do a lot of research. It was to say, will this work? Will this work? And it meant carrying everybody with you, whether chiefs, civil society, young people, because in the ultimate we were saying, our future. We can't see, we just, decimated. So that is basically that. And of course, the mental aspect, I want to emphasize that, because these days, what I'm seeing is that we need role models who can role model behavior to our children.
Yeah.
We need even the support young one. Anytime I would talk to face about what are you thinking? If that child, if they had somebody that had just told them, face
it's okay.
Yes. What would have happened?
Okay.
Yeah. The relationships, if you look at gender-based violence now, you are thinking, we do need good mental health. And it's possible, but we need for it to be multisectoral to ensure that people learn from couples, for example. Can there be a couple that can come over to another older couple to say, but or just two people who are together, when they fight, nothing happens, and then they end up killing each other or hurting each other. So that's where it is. Yes.
Yeah, and on that, because it's an area I have 4 kids and young adults now.
Yes.
And this thing, and I've seen, I think we used to say affected by HIV/AIDS.
Yes.
These days, I think almost every family is affected by mental health.
Yes.
So it's a big epidemic. And interestingly, it's not just the Botswana thing. It's an Africa thing. It's a global thing. Yeah. It's interesting that, in the United States with your travels, their life expectancy is actually dropping.
Yeah.
And a lot of the experts also relate to the mental. They say suicide rates for especially teenage boys, it's at epidemic levels. It's just getting crazy.
Right. Yeah.
So the way we are developing, I don't think the attention to, and I like that you mentioned it, social and mental. I don't think we're giving it enough attention that I actually don't have hope or in the short, medium term, we will arrest it. Sometimes it's around the but that doesn't work.
It doesn't work. And I'm glad by corporal punishment, because that one doesn't work either. It simply emphasizes it just doesn't work.
Yes.
So what we need, where parenting, where let's say, kinship ties are weaker, we now need psychotherapy, services even at community level.
Yeah.
So that people
and accessible,
accessible, so that people can access them. Because sometimes you think, okay, maybe they can just do it. There shouldn't be any stigma. I saw that when I was during the AIDS epidemic, when I thought my own health practitioners would go to the very hospitals where they are for testing, they didn't because of stigma. So I had to then work with the nurses to build a care center specifically for health professionals so that they can get there and be counseled by people they don't know. Why, Bona? Because they felt like, so if I find Sheila there, she's going to say, So it was people, and it worked that way. So that sometimes it may actually mean going to strangers who can then listen to you without having to maybe politicize or having to stigmatize you for what you are thinking or doing. And the church is very useful in that.
It's another instrument.
The church is also another instrument where we are able to go to, whether it's a pastor or a priest, to be able to just give our problems and see how somebody can be able to pray with us and, give that counsel that is so important. Of course, some pastors are something else in the same manner as some priests are something else. But, but the point is that as an institution, religion is very important.
It's very important.
Yeah,
and it's got this counseling aspect of it as well.
Like when I was a minister, religion was very important to me because we actually had the Botswana Christian AIDS program, which for some reason, I don't know how come, men preferred to go there for testing. So I simply said to them, okay, I said, I don't know what you are doing. Whatever it is you are doing, I'm going to fund you so that you continue doing it. Men went there. I would have thought that men would have shied away for Botswana Christian. No, actually, more men were testing there than at the development centers.
That's amazing.
So, and it ensured, therefore, that we brought men in. And it was good. Yes.
No, wonderful. Now let's revisit the HIV/AIDS issue because that's where, and I'm glad you mentioned that Mogai is actually writing a book, which we're all looking forward to because you worked with him during the time. And I'd just like to read out a Botswana HIV scorecard. Just in terms of how, is it a star or is it a B or a C? So, mother-to-child HIV transmission rate reduced, and I'm from 30% to 8%. This is between 2003 2008.
Within 4 years.
Exactly. Yes. Mother-to-child, you'll talk about how phenomenal that is. Near elimination of mother-to-child transmission, I mentioned that, now almost less than 1%. Near universal access to ARVs, and there was a first in Africa.
Yes.
And I know that you can touch on that. And then the achievement of UNAIDS 95 targets. You'll talk to that a bit more. And then, why that's so special was that more than 91% of all adults living with HIV have viral load suppression exceeding the 2030 targets that were set, which was very special for Botswana.
Yes.
Importantly, HIV prevalence among young women significantly reduced. But I'd like to visit that later because I think it's still a bit of a problem. I get it around that. So with that beautiful scorecard, the issue is, and I think you are right, hence all these accolades and awards. What was the success? What is the ingredient that made this a huge difference? Especially when you walked in from university to become the minister under President Mogai.
Well, working in from the university, I was already a civil society person.
Okay, you're still already an activist.
And let me tell you, people think I started working with Mogai at that time. No. In 1990, when I founded the Society for Women and AIDS in Africa, that's the Botswana chapter, and I founded this organization, we had no money. You know what I did? Reto was going to buy me a car, a Mercedes-Benz. I had just done my PhD.
Yes, I just got your PhD.
I had to ask him, can we postpone the purchase of the car? Can we borrow this money? please lend us this money because I want to start this thing. I know we had done a proposal. I said, we are expecting some money, from a donor in America, but I don't know when it will come.
Yes.
So can I? He was saying to me, Sheila, what if that money never comes? We'll get back to that one in Kadima. So I took that money, and the money came like 6 months later, and that's when I bought my car. But already we had started teaching women about HIV, especially teachers in the thing, in the banks.
This is 1990s now.
This is 1990. Yeah, in 1990 actually. Yeah, I finished 1988.
Okay.
So 89, that's when we were doing, but 1990 was when we now had that money that I had and we were able to do. Remugai came to me. He was at the bank then. He came to me and said, come, little Huruta, Bank of Botswana.
Bank of Botswana. You was a governor then.
He was a governor then. He said, Bank of Botswana, it needs you. Come and do that. And we went over there and we were able to do women and AIDS prevention. But he said, we are not leaving men behind either. And we said, okay, they're also actually paying because they were paying for their meals and all. We didn't have to spend money on
on those basics.
It was great. We covered the people. So that by the time he got to be vice president, he was really now well-versed and he knew, he would say, how do we do this one?
So we worked together already.
We worked together even before that. And he actually wanted me to come earlier.
Okay.
Like as early as 98. But my husband then said, Sheila, Ghana, this is politics we're talking about. Right now, you're on the way to professorship. Why don't you become a professor first?
Yes.
Once you have your professorship, then you can do anything you want, whether you join politics or whatever.
Which was a fantastic
advice. Because you get there and maybe politics, they don't want to. But in 3 months, they kick you. You are able to come back to the university. If right now, and I said,
took
you
the
are right.
advice.
So that's when I joined then in 2004. Which was really then a time when I now already knew what was working in terms of civil society mobilization.
Yes.
And what could
that
be done.
That experience was also valuable.
That experience was there and
Very
I already
valuable.
had my roots now on civil society.
Yes.
To the point where when I came in, because I was made a minister, it was a surprise. I didn't know.
You just came in, member of parliament, was it Palape or something?
I was with students at the university. I was already AIDS coordinator, talking, in fact, about the female condom, teaching men how you use it. And then the phone rings. He's like, hello. And they say, Sheila, you are wanted for parliament. Can I get a for what? But you are being sworn in. They're swearing in the afternoon. Can I get you saw the papers. I get you are a potential. But I mean, papers always.
Yes.
The students comes, gets me. And then I'm now told, can you be a minister?
Yes.
Provided you give me 15% of the budget. Remember when we were civil society, we had agitated.
Yes. We didn't have resources.
Of the budget should go to us.
Yeah, so that's a condition.
There is a honeymoon here. I might as well capitalize on it. Provided you give me 15% of the budget. I'm giving you about 20%. Fantastic. But I want a report every 3 months, Kari. You're on. Yeah. I called civil society and said, guys,
we're on.
If there's one thing that we must be known for is lowering mother-to-child transmission. Go into the villages. I'm funding you, go into the villages. Work with the mothers-in-law and the mothers. These women need a lot of support in not breastfeeding. I agree with this stigma.
Yes.
So it was like, let's go there. And they were able to go in. We had already gone in during the time of joy.
Before,
Yeah, we went in, but the funding was not forthcoming, but I was willing to now fund. And then I said, for people that were putting on ARVs, I need them to have a body. So that as we put somebody, there is somebody out there who's already living with HIV who can support them to say, I am on these tablets. Kanana ko di tablets aten witu ne ido di seli. No kona le go tin stockrine. Stockrine, you took it, but for the first 3 months, that's 90-something days, you had nightmares galore.
Oh!
Tau would eat you, spit you and eat you again. So I would meet people sometimes as the stigma was going down. One time I'm talking, this man comes over, Minister. I mean, in front of people, just talking. Yeah, so good. No, I can say me in for how long a month. Me each hocker in 2 months.
Someone said,
yeah, that means by that time they didn't pay this. But it was really great because what I never said. And I thought, okay, when this is happening, stigma is also going down. Because he is somebody who says he's taking it.
Yes.
And he said, no, I'll only listen to you because he's from the grave. Now I was literally in the grave. I'm out now. Pick it up. So get a horesa, but just know that this is not all. so you needed. And then I had to work with Bohel and Ditsele. They had a coping center for people with HIV who became buddies. To this. So by the time we compare with other countries, our adherence levels were high. People were on ARVs and staying, and the side effects were not that bad. Because what we also did was to work with Member Nasha to say, Savannah, I net about it also.
Local government, yes. Dealing with the districts and everything.
Yes, to say, let's also have
so you cooperated nicely there.
We cooperated very nicely because it was under primary health care. And we were able to then say, let's ensure that as people are on ARVs, they're also eating well. So it worked very well, but it meant real collaboration, working with chiefs to say, talk to them, there is something here. And because people are still afraid, stigma to test it. And so it meant, how do we then work with civil society to ensure that people do come? And in fact, when I was there, no one else 3x5. The world has said by 2005, they'll have put 3 million people on ARVs.
Okay.
In our case, we had our own number and we surpassed it.
Oh.
So the 3x5, and then there was a 15x15. 15 million by 20, we surpassed it
as well.
So that became then the trend to the point where now HIV from mother to child, the mother to child transmission is less than 1%. In fact, Botswana has got just recently at the World Health Assembly, we got a Gold Star Award.
Oh,
that is saying you are a few steps from being awarded completely HIV free. From mother to child.
Of mother to child, yes.
Mother to child, but also hepatitis and syphilis.
Okay.
We did triple elimination. We are still a little bit behind hepatitis.
Okay.
So we are working on that, and right now, Keberaka minister, and we'll get there. So it was really great to get the very first country in the world to get that star.
Wonderful.
And of course, I was there, and people say, Sheila, this is yours. I feel so great for we have conquered at least, But of course, we can't sit on our laurels because, as you said, among young people, we are seeing it. Why are we seeing it rising among young people?
Before we get to the young people,
yes.
let's talk about it, because I want us to visit. Sometimes we do things very well.
Yes.
And we don't research them. I mean, you are a researcher.
Yes.
We don't document them such that they can be available for other instances or events that happen like that.
Yes.
So you've unpacked I like you always go back to primary health. I mean, I love that. You have to go back almost to basics, isn't it?
Basics.
Ground level, ground zero.
Everything that I do, even malaria, primary health.
Go back there. And it looks like that's a good deal.
Yes.
Now, I wanted the decision for free ARVs. How did that come about? Because if you agree with me, that was one game changer with you, Leramogaya. How did that?
Yes. Well,
because that's a big budget issue, isn't it? That's a big budget issue.
Yeah, but don't forget that with free healthcare under primary healthcare, which we already had, there was no way you could even charge for ARVs. We had people who were saying, maybe you should charge for the tests that they take. But then we knew that if you do that, then people are not going to access. It will, a lot of people may not access. So it had to just be free. And that's why Botswana was the first country to increase that budget to be on 15%. After that, I was working with other ministers. Luna, where are you? And they will be at 9%, Bangwe 80, Bangwe 10. But none of them except Namibia ever reached 15%.
15%.
And I was able to say, that's why I am now marching ahead of you guys. Because because we have put our own resources. And the great part was that donors like to jump on the bandwagon of the success.
Yes.
When
That's
they
how we
could
attracted more.
When they could tell that Botswana was, hey, PEPFAR.
That's how it came
once
that time.
Once it was instituted, PEPFAR was the first to come here.
Yeah.
And already when they came in, the very people that they found on ARVs, they were now reporting to Congress, we have already put 20,000 people in Botswana. And I'm thinking, but you came yesterday. and I remember there was a controversy still there in the Washington Post where they were saying that they came over and they're asking the Minister of Health to do a lot of things, and she has told them that you can go away. Now they're claiming that they put people, yet they only arrived. We asked them, and they're saying, well, since we had a workshop, once you've used the pen, it means you are part of it. So I had to just say, look, this is a donor. We need to work well together. So I simply said to them, look, clients don't belong to anybody. These are people with HIV. They are people.
There's serious need.
We work with them together, and so the American government is fine. We don't have to divide who is who.
Who is who,
but
and compete over who. Yes.
But you see, it was a really great decision on my part in that when they went to Malawi, they were saying those that you put on your own budget, have them in separate files from the ones that we put in. With me, I had told them, no.
It doesn't work like that.
We are here together. I said to them, I am here. I want to get there. With your help, I'll get there faster. But I will still get there anyway because I already know the route to get there. So you are in or you are out. And I told that to President Mkhai. He said, what's recent? And after that, we worked famously together. That's why now the mural at the American Embassy, PEPFAR 20 years, it has Sheila there. It has Sheila there to say, this was the main PEPFAR
Sheila
person.
Yes.
I mean, it has me on the mural.
Did.
So it's really great. I enjoyed it when the ambassador came and showed me the mural, the wall. Yeah, well, okay, that's great. But it's
because you're on the board there now, isn't it? Or the PEPFAR?
No, I was in the PEPFAR board before.
Oh, before.
But now they were celebrating their 20 years of programming. So they figured, well, the person that we was really ours is this one. So it was great. Okay. But the thing is, donors were also good. But what then happened was, with the advent of the Global Fund, and I'll tell you where Matata came for a lot of countries. When the Global Fund came, it came in as a top-up where they were saying every country should budget and then we will top up what is needed.
Okay.
But for some countries, then they simply decided, we're not even going to have a budget for HIV. Global Fund will give us.
Give us everything.
So it became that dependency. Later, when I was regional director, there was a time when there was no money in the Global Fund. And right now, because of ODA that has been cut by other countries, the Global Fund has no money. So I'm finding myself still being an advocate. You said advocacy. I'm advocating even now to now say, countries, let's put more money, domestic resources and all that. So it's really that we have to ensure that our countries put money into their people. In the very same way that Remukhai put money into his people. He never hesitated. Somebody could have hesitated to say, Ghana, it means we are going to do away with secondary schools. We have to
reallocate our budgets.
It would be for
It's a survival thing.
It was a survival. We needed our people to be alive.
I remember in the 90s, we were burying people in the 90s.
People. It was something else.
Yeah.
For me, the very first time when I went to Kachikau, as far away as Kachikau, I got there and I asked them, has there been a child born with HIV in the past 2 years? And they said no. I cried. Yeah, because I had really said, for me, it will not be the urban areas. I need to make that impact where the people are. Because anybody who's coming to come and give birth, because they're waiting for
facilities.
So we work very well with Memanash to just say, let's beef up the clinics in such a way that they can start giving ARVs. And the first successes we found were right there in the rural areas. That's why when I became regional director, I was now advocating, working with countries for urban hotspots. Because I knew in the urban areas, even where you are succeeding, there are still some hotspots. Like Old Naledi, Bukukai, where you need to go and get the people there. Otherwise, transmission will not
spread, because it spreads very fast if it's under control.
Very fast. Yes. So that it's a story, but as you say, documentation came at we were doing. We had no time.
Yeah, you had to work. Because it's a do or death thing.
People keep saying that, I'll go anywhere. It's like, Sheila, what we're learning from you. Okay, so maybe I'll document now that I have a little bit of time sometimes. I say, but at that time, there was nothing like documenting because we were doing and we were not learning from anybody. It was a trial and error, and we had to just take it as it comes.
Documentation. The other time I was at a presentation, chemistry go UB.
Yes.
And then there was Professor Moyo from Harvard.
Yes.
He presented on the statistics and the demography of HIV/AIDS map in Botswana and all the details. And it's like, they really went and then obviously we work with the Americans.
Yes.
But in the end, countries grow because of IP. That unique knowledge that even later you can actually monetize because you teach others. But apart from when you are in you call it the coal face in mining.
Yes.
But there are others who could be, the academic institutions could be working in the background, getting the data, cooking it, generating knowledge. So Professor Moyo at Harvard was like, is this ending up in Harvard? Because Manila are very good at that.
Yes.
The lessons of HIV/AIDS, and I want you to put on the professor hat.
Yes.
Do we capture the IP generated so that if there is an epidemic in Thailand, to borrow the people with the nice colors.
Yes, with nice colors.
Well, they say, now show us, and you say, this is exactly, and we can actually come and help you, and we can actually monetize it. And they say, do it as a service to help us.
To do this one. I think now we now have professors. Before it was just us. We were very few.
Yeah.
And that's why I'm saying we are doing, because I worked a lot with Harvard. In fact, the very first vaccine trial, I was right in there before I was a minister. We were doing vaccine trials, and the thing didn't work. The candidate that we have, it wasn't. It was like, we found it like a 15% effective, and that it won't do. But but then, of course, if right now you look for that information, it's at Harvard.
Yeah.
Why? Because it was not generated from our own. Everything that we have was generated from Harvard. When I became minister, I said to them, I need a study. The global study shows that transmission occurs at around 30 weeks in women. And I said, but you see, I need my own study for Botswana women. When would transmission likely occur?
Yes.
Because that's when we can then target the women to say, we're giving her AZT before she gets there. And they found for us, it should be 28 weeks. And therefore, I started at 28 weeks. And I was able to tell other ministers I don't know about you guys, but they had no money. I don't know about you guys, but in my country, this is what we found with the Harvard. I got out of Harvard.
Yes, wow.
And that's in transmission is. So that's why I'm starting. And I'm seeing this progress. So it was really, to me, I was always the minister. I felt good because anytime I went and I stepped anywhere, it was like, she knows what she's talking about. Because I was working more with them. But then I'm sure, as you say, if you want that data now, you'd have to get it from Harvard. So we need.
But you see the unfortunate part of it, where I'm drifting to. You get my drift. In other words,
I get your drift. Right now, if somebody wants to write a story about me and my interaction with HIV, Harvard would tell a better story, because they were there even before I was a minister when we wrote the book AIDS in Africa. I went literally to Harvard, stayed at Salem, and we wrote the book. Yeah.
Not your mother university of Botswana, where
and they
you
were
did
there when I was at the university. Thailand, the reason why they actually wanted me was before, when I was civil society, they actually called me. I went to spend some time in Thailand to look at their HIV situation among sex workers.
Okay.
And I got there and I said to them, guys, if you don't legalize what I saw with 8-year-olds in the street and all that, if you don't legalize, sex work and condom use, we're not going to go anywhere. The king was so reluctant, but when he did, he actually saw.
Oh, the numbers dropping.
Numbers were going. That's why he later said, that woman used to come here. Bring her. So it was great. That before I became Miss, I had actually worked. A lot I had already received. By the time I got the presidential award. I had already received about 15 awards from outside.
Oh, before then?
Yes. Right now I'm at 30-something. I no longer count. It's like,
no.
Award. Oh, okay. Are they giving me any money? Say, no. It's a little, okay, I'll go get it.
It's a recognition.
These days, I want money. I want one that comes with money. You know why? Why? Because I'm also a juror in one of the greatest awards for nurses. Mm-hmm. It came from my Nursing Now campaign, who I was trying global campaign so that nurses can be seen to say, look, without nurses being properly trained, without being properly retained, and really being leaders in the healthcare system, we are not going to reach universal health success coverage.
Nurse is almost part of that primary. Yes.
So that was my global campaign from 2000. Yes, when I was regional director, I broke off and did that campaign, and because of that, a company in India decided that they're going to now have an award, $250,000 for a nurse, a super nurse in the world. So every year, nurses from all over the world go in and you write what you are doing for your community.
And you submit.
The first person to get it was a nurse, Diba, in Kenya.
Wow.
250,000. So in fact, when they asked me to be the grand juror, to be the one who finally
from the other jurors, you are the grand one.
The grand one.
You are the senior one.
They bring you 10 names, 10 people from throughout the world who have now been the top 10.
Yeah, the shortlisted one.
The shortlisted one, top 10. And then I determine which one real of them wins. That's right. But when they asked me to do that, I was saying to them, but impempili, because I think I'm the super nurse. And they said, that's basically why we don't want to give it to you. Because we knew you would win it. So now you tell us who should win. So that. I just came from Dubai where they were. And this time it was won by a Ghanaian.
Okay.
The first one was won by a Kenyan. Then it was somebody from the Philippines. Then UK.
It's global. It's global.
It's global. Like the top 10 were actually 10 different countries. Yeah. So 2 from Africa and then USA, UK.
Beautiful.
So, but it's really great because it now shows what nurses can do and what they're doing for their people. Like this other one was working with communities to end female genital mutilation.
Dima in Kenya. Kenya one.
Yeah. To end female genital mutilation. So with the 250,000 that she got, US dollars, that's a lot of Kenyan shillings.
It's a lot, yeah.
She's built now a school so that she can even teach parents to not send their children to have that.
So get the education and everything.
It's one thing you can legislate against a harmful custom, but you need to also be able to teach people,
empower
them about the dangers of having that and the fact that it's now outdated. We can have something else if at all you want, girls to go through puberty and all that. Yes, yeah.
Emma, so let's move on. I want to ask you now, based on the whole picture of the Botswana success, to say now, what do you see as, we've talked about the ARVs, the mother to child and all that. What's now being still occupied with the industry, so to speak? What is the next frontier when it comes to prevention and even the technology around that? What should we look forward to?
The next frontier is elimination. Yeah. Because it's one thing to say we have brought it down. HIV, for example, is almost like a human being. You don't bring them down and forget about them. They come back again.
Yes.
Yeah, Tanya. And it I meet Lady Teju. So that's basically where we are. We've brought down HIV to near. I mean, when I was regional director, I was in charge of the only region where we saw a 50% decline in new infections. So
region Eastern Africa.
And Southern Africa, yeah.
50%.
I worked that hard that we were now at that.
Wow.
I'm now working with Western and Central Africa because much as Bonnie, they were not that well affected. However, a lot was not done, so they still.
Yes.
I mean, if you are saying prevalence in Nigeria is 1%, you are talking about 20 million people. Right? It's not like in Botswana where you're talking.
It's a small number.
So I chaired the Global HIV Prevention Coalition, which is now looking at countries that are by numbers bringing more people, having more people living with HIV in terms of absolute numbers. India, Pakistan, China, Nigeria, Kenya. So it's about 40 of those countries throughout the world. Still, you don't want to leave them behind.
Yes.
Yeah. Really, we're now working with those solid countries to say, if you can bring down to even less than 1%, we will be going for elimination. But what we also found was that because we are no longer burying people, we are no longer seeing, HIV. We are now seeing, a certain like blasé where now people are just chilling.
Infections are even
sitting on the laurels. I mean, right now it's not just Botswana. You go to any one of the countries that I visit, I don't see a billboard of HIV.
The campaign.
That's right. So most of the time when I get there and I see the president, the first thing I say, Your Excellency, where is the billboard or any chime about HIV? They say, you didn't, you see, it's like, by the way, how do you? Yet HIV is still there. And now we're seeing it rising among young people who don't know what we saw. You see, the thing is during our time, when we were young and HIV was there, we were scared because we saw
it all over.
Face of HIV. We saw people being buried.
You saw your cousin, you saw your mother.
People now, they don't know anything. My own children say, why not really? And you think, but guys, take care of yourself. But now we fear only pregnancy. But if you ask a lot of these young people, most of the time they fear only pregnancy. There is something. Take care of yourself still. So that's where the message, we still need that. And one way we could do it is to really have sexuality education, life skills education at primary level, at secondary school. Yeah. And it's controversial in some countries. I had a country, I'll mention, Uganda, where they stopped having life skills education. And
it's one of the countries that was hard hit during those days.
It had been one of the countries that was hard hit. A lot was done, but now it's coming up. And the people there, but they're Christians. So we'll just talk to the children about abstinence. Yeah, I said to the First Lady, the last time I came, you had 280 new infections per week. I'm now here to tell you there are now 567.
Over double.
They are doubling. Why? Because you have stopped. She's the Minister of Education. You stopped teachers to teach children basics about the human anatomy and physiology. So it sometimes it comes to that, where the conviction. Somebody says, I'm a born-again Christian, and therefore that's it. And therefore that your religion then spells doom for other people. So, but I think the main thing is that I'm still on advocacy, saying we can eliminate. Sustainable Development Goal 3.3 says eliminate the epidemics of HIV, TB, and malaria. And that's what I'm basically on right now. Malaria in Botswana, when I left, we were close to elimination. When I was a minister, we actually had in fact, there was a time when we had 0 deaths. And we had less than 1,000 cases. It's been that trend, but, now we've seen people dying.
Oh, from malaria.
Yes, from malaria in Botswana. We don't want that. So I'm now working with the new minister and with the president. That's why he's now the chairperson of the African Leaders Malaria Alliance, of which I'm ambassador, to say we are going
Who's
to
the chair,
eliminate.
the minister?
Yes,
the minister of
the president is the chair.
Reduma,
is the chair. Because this is a coalition of African leaders, our presidents, who are saying we will have to do something on malaria.
Okay.
So every year they have rotating chairs.
I got you.
And this year is our own. And
Yes.
as I said to him, your legacy, we are eliminating malaria in Botswana. We can do it.
And you are right there to support him.
I'm right there to support them. I'm right there to work with the minister. In fact, I went with him to London.
You mentioned
to go and work with Malaria Normal UK, and to also ask the British to not put very little money into the global fund, to say, can you increase your budget in the global fund, because it will help other countries. So that you see, if when President Boko finishes his term and we have at least 4 countries certified malaria-free. That would just be so great. That would just be, to me, it would be that's when I'll go into the coffin smiling, because it's possible. Already we have Mauritius, which has been certified malaria-free, Algeria, Egypt, Cape Verde in Africa. So that it's not like something that is not doable. We know it's possible, especially for the countries of Botswana, Eswatini, South Africa, and Namibia. We can do it.
We can do it, yeah.
Yeah, so but we are working with other countries, especially French West Africa, because sometimes they were left. Yeah, yes.
I want to visit the word elimination, because, one of the things, speaking as lay people, is it possible to have HIV/AIDS-free society, either through cure, or is it behavior? How do you attain that elimination where you say Gaborone has got no case? Is the science going into cure, or how? Yeah, just talk to us about that.
No, I don't think there'll ever be a time when we're saying there's no case. Elimination, when we're talking public health, is where you are saying it is no longer a public health threat.
Oh, got you.
That's right.
I got you.
So that, if you look at HIV now, the way we worked on it, it was now a chronic disease, just like hypertension, where we had even proved that once you are on ARVs, you cannot transmit to another person. That simply means if you and I are a couple, I could be infected. If I'm taking my ARVs, you're fine. Do you see how if now we're together, we don't transmit to other people? It becomes just that. When I go, I'm gone, but I have not transmitted to anybody else. So that it now becomes a disease just like hypertension. In fact, when you look at it now, the cost of treating and managing a person living with HIV is far less than managing the person with diabetes and hypertension.
Is it?
Yes, right. Yeah. From where it was 10,000 to where we are now. Remember at that time, when it was 10,000, people were taking 13 tablets.
Yes.
Sometimes
So
3 times.
Now it's one.
Now it's only one.
Yeah.
And now we're actually looking at an injection that could be taken every 3 months or every 6 months. So, and we're hoping that a cure then will come. But even without a cure, we can still be able to control it.
Okay.
As long as we don't ensure that people are infected, because what then happens is that 95 means those about 5% that who don't know their status are infecting. And guess who they're infecting? Young women. And that's where the problem becomes. So that I don't see a point where we'll go back to the 80s. No. However, it is a problem enough that we can have because of stigma then. Because now the young people will say, you should have known better. Don't you know there's HIV?
Exactly,
Then somebody then doesn't access medicines they go and kill themselves, especially because our children, for some reason, when killing themselves is such a simple thing. So, So that's basically that.
Elimination
is. So that's what elimination would be. Even malaria, elimination would not mean there are no more mosquitoes. Elimination would be people are aware that they can sleep inside a bed net. We now have vaccines for children to take, so that the malaria, even when the mosquito bites them, but also killing the larva of mosquitoes in the breeding grounds to ensure that they don't multiply.
They don't multiply and come into the houses.
Yes. So that that's basically that.
Okay.
Yeah.
Let's go up into the continent now as a former UNAIDS regional director.
Yes.
And the countries.
Yes.
And we're talking about leadership now.
Yes.
You know, people like yourself, it's always in entrepreneurship language, you talk about scaling. In other words, scaling meaning having more people like you, having more people like Remochai, where those elimination and others we can start containing.
Yes.
But I want you to talk about how Africa is performing and the role of the leadership and the strategies to really contain. You can even touch on where we come from. Remember big countries like South Africa, which had the highest number of people on ARVs, and also the beetroot debate. Where are we now? Now, from an African perspective.
I did forget. In fact, I did forget about the beetroot debate when I was talking about how I would talk to the other ministers. Remember, at that time, there was a minister called Manto Chabalala.
Of course.
A very good minister. You know, apart from HIV, she was
actually good.
She was a very good.
Now we found it as a joke.
This was the minister who, when you say to her, Manto, I'm working with traditional healers. And I think you have a very good impact. When I want to lead Sangoma, can you have a movement where all of us are working well with traditional? She would put forth. She even went as far as the World Health Assembly, where traditional medicines was now.
Okay.
Let's recognize.
Okay.
So it was basically that. And I had told her at one point when she was saying, traditional, let me tell you something. I had a patient in Marina who was hiccuping. I think it was quite a number of days, and they could not stop it. So one of Dr. Majani says to me, Minister, can we have a problem? Go, Marina, this is what's happening. So I said, call Dr. Sukunupo. Sukunupo was the chairperson of traditional leader.
Okay.
So he's looking at me. No, he may help you. You know, all he did was to take a feather, whatever that feather that was. And he bent it and put under the nose. The hiccup stopped within 5 minutes.
Right there.
And stopped forever. So I was telling Mando that, and she, no, sometimes they were, and she was able to do that. We had at one point a case of polio in Namibia. The Minister of Health of Namibia called me and said, Sheila, I have an imported case of polio. And it could really go viral in our... So I said, let's close the borders. And we knew we didn't have a lot. So we phoned Manto Chabalala, told her, and she supplied with all the tents, the whatever, for manning the borders and vaccinating children as they came in and out of there. It became that one case. If it had not been for her, or if it had not been for our collaboration as ministers, we really collaborated with each other. We phoned each other and we'd make a decision before we even told our superiors, the president. Like this polio one. By the time I came to tell Remochai, I was already saying to him, we have manned the gates, and I hear that Abazezuru have taken the children, Baba Sisi to Zimbabwe. But when they come back, I'll be right there with them. And indeed, they came complaining, Minister, when they left Botswana, they would be having supang where So it meant that, but it meant our collaboration was that good as ministers. And in fact, I was telling even our own now to say, collaborate with your colleagues because you are then able to make decisions, steady, effective. Remember how during COVID, somebody would say, Botswana, lock up is like 7 o'clock. Go South Africa is like 9. Go Namibia, and you think, these ministers, where are they? Why can't they call each other and say, let's agree so that our people can move?
Exactly. The protocols could be aligned.
Simply say, the protocols were not aligned. And I used to just say, but what do you call? Can you call your colleagues? Manto was right there. We differed only when it came to HIV.
Oh, the rest was fantastic.
The rest was just fantastic. HIV, she would tell you about poverty. Manto, People there have died, including doctors who are not poor.
They had a famous judge. They had a judge who had lived
right.
there.
Yeah. And it was like, no, they were not eating well. So you say beetroot and garlic. Wait. So that when I became then regional director, it was really great because I was then stationed in South Africa. And I needed the first courtesy call should be to President Zuma. He was great.
Oh.
He talked to me and said, welcome.
I was going to chip over. Is there a word great sitting next to President Zuma?
No. He said to me, I cannot be the face of AIDS. Yes, you know my lifestyle and all that.
What is that? Yeah.
Yes. And I say, okay, Your Excellency. And he says, so work with my Vice President, Cyril Ramaphosa, and just see how we can work and assist us because we have 6 million people who are infected. There are very few on ARVs. And I was able to work with Cyril Ramaphosa.
And you pushed it.
We pushed it. At one point I was saying, say you need to have something, a plan, a strategic plan, an implementable one for sex workers. But sex work is not legal. So why don't you, because you are South Africa and you are the model country, and you have all these human rights things, let's put it, we were able to launch a plan for sex workers, which was so nice. The sex workers were there and when I addressed them, I said, my fellow sex workers.
Oh, you said that?
Yes. And he's looking at me like this. I said, Mr. Vice President, in the ultimate, we are all sex workers. Some are prepaid, some are postpaid, some are on contract, and he died. So that's right. When he came for him now to do the keynote, he says, and my fellow sex workers, and they went, in the meantime, we cannot stigmatize this.
Absolutely.
We all have our way, but we should be able to do it in such a way that we are not a danger to ourselves and to other people. So that's basically that. So that we're then able. So I am very proud to see that now South Africa is 7 million, and my little finger was right there. 7 million people now on ARVs, and I was working with them more than other countries because other countries had been moving. All right, it was really a question of how do we assist you with this? And the good part, I mean, you are talking leadership. In my case, I'm still really seen, even especially outside, more than in Botswana, as that leader. You know why? Because I came with that aura that she knows what she did in Botswana.
Yeah.
And therefore, let's listen to her. We need that expertise.
So you got the practical experience.
And therefore, with my kind of humor, I was able to sit over there to charm them. Sometimes I didn't charm them. Sometimes I didn't charm them. Let me tell you about President Mugabe. When I was regional director, we had the gay and lesbian association of Zimbabwe. And he just did not like it.
Yeah, he had an issue. He had a big issue.
One time he heard that we had funded them.
In Zim.
Through
civil society.
He said, these people, they exist here. About deregister them. Anyway, they have been deregistered. I got on the plane to Zim. Yes, to him. They made data. The minister was parading out there, and he said, well, go and see the president. Then we can come and see me because I said, fine. I get there. And he was not amused. When immediately I started, Your Excellency, he simply stopped me halfway and said, Professor, God did not create Adam and Steve. God created Adam and Eve. And I had already thought of it. This one, I'm going to take it from a mother perspective. Yes, Your Excellency. But Steve is here. Steve is your child, yours and mine. All I'm saying as an African mother, and for public health reasons, is that Steve should have the same access to services as Adam and Eve. Is that too much to ask? By an African mother? And he's looking at me, and then he looks down. There was a moment of silence that I think it was probably a minute, but to me it was like 3 hours. And he says, well, yeah, I guess when it comes from an African mother, I have no choice. But to listen. But you must talk to the West. They keep on shoving these things down our throat. But Your Excellency, are you aware that if you and I took care of our own children, to all of them, Adam, Eve, Steve, whoever, the West would not mind. Maybe they're seeing that there's a gap somewhere. And only you and I can fill that gap. He said, yeah, I guess you are right. You'll get my response, tomorrow.
And you got it.
So I go to the hotel. No, later that evening, the president has, says we should tell you that they have now been re-registered. And it was like, okay. So it had its own
you have to be
whatever.
tactful. You have to know the profile of who you are meeting and how to approach.
I was so prepared for it because I had already had some of those, misunderstandings, even at country level. At one point, we had done research to show that prisoners go into the
HIV free
into jail, HIV free. They come out infected
in Botswana.
And that research I did as a professor. And because of that, I talked to the wardens and we were able to bring, to go there teaching. Ageroko is part of teaching. Primary health care, we're going to teach the prisoners how to take care of themselves. But in there, we put HIV in there. And we also smuggled some condoms. When I became minister...
Before you became minister, you could smuggle.
When I became minister, I'm thinking, now I have the power.
Legalize smuggling.
I'm going to get there.
Now get out of the smuggling.
I talked to Remochai. Remochai said, no, do a memo and bring to cabinet. We'll be able to see what to do. Public. That memo got there and you found conservatives and liberals. In cabinet. We said, no. And somebody had to say, she forgets that, the minister forgets that she is specially nominated. Over that will register the top. What will happen if people get to know that we are giving condoms to prison? Who is going to broadcast?
Exactly.
Because right now, we've been doing this repetition. Nobody. So what are you saying? So Remochai says, Minister, and I thought it would be easy. But as you know, we work according to consensus. So, my thing is that maybe you should just continue smuggling. And I'm thinking about the
whole cabinet.
A whole cabinet. But later, the vice president came over, went to me because he was most adamant that one is not going to happen. He comes
Vice
over.
President Kama.
During tea time. Hanka what you smuggled condoms in prison. I'm going to arrest you. Actually, I would like that because then you'd have to explain to the international community.
Yeah.
For when the minister is acting based on public health principles and based on research, what do you want her to do? Should she just let these people die or whatever? So it didn't, but I had to just keep on smuggling.
And it was no big issue. And it didn't become a big issue.
Yeah. Yet other countries, but sometimes, of course, when you are in your own country, sometimes you are not that well heard of. Other countries, when I went to Madagascar, it was very easy for, actually the regional director, you are right. This is research. We're going to do that. Yeah, let's
just
do that.
Like that.
Yeah, let's do that. There was no halabaloo. There was no. So it was more like, oh, okay. And you saw the prison population, being really
because
going
now,
down.
just for the viewer, it's legal now in Botswana. You give it no more smuggling. Just to be clear.
I'm hoping that it is. But one thing also you mentioned that elimination to say one of the things that help us with elimination. What to say, before when I was minister, we were treating people, you had to show a CD4 count of this. And sometimes somebody didn't show it, but then they were sick and then they died. Still with a CD4 count, that was high. So when I became regional director, one of the things that I had really suspected when I was a minister was that, because at one point Remochai was saying to me, Minister, you must be doing a good job because we are seeing infection rates going down. I said to him, I don't think so. You are saying in terms of behavior change. I said, no, I don't think there's a change in behavior. Not much. I said, not even among members of parliament or whatever. I said, you know what's happening? I think as we are putting people on ARVs, they are no longer infecting other
others.
people.
Yeah.
It's the same way as mother-to-child transmission,
Yes,
the way it worked.
Mm.
Really. So I held on to that theory. When I became regional director, I said, look at that. And indeed, we came up with that thing of treatment is prevention.
Mm-hmm.
And I came right here in Botswana to come and launch the Treat All, where we are now saying, once you're HIV positive, we treat you. That way you won't transmit to anybody.
Yeah.
And you'll be able to take care of yourself and not to function. So it was actually really great because now that's basically what UNAIDS went with. Treat all. And we treated all. And that's what really has
the
brought
numbers
down.
have suppressed.
Yeah.
Okay.
So much.
Okay. But going back to the leaders, because you're giving very unique examples of President Zuma, President Mugabe, the president of Madagascar. But what I want from you is that, is it now progressive? Do you see, as you interact with all these leaders, you think there's things that were pulling us back in terms of traditions like President Mugabe, like Christianity, which Africans we've taken on, like what happened in Uganda. But do you see that, are we having people who listen to people like yourself? Are you having more Sheila Tlous across the continent? We are remotely.
No, it's more progressive. No, it is more progressive in this sense that when I was regional director, now when the epidemic was going down, because people are now treating all and prevention, we now had to look at other aspects of prevention. For example, child marriages. So we said, let's attack child marriages. And we had to do a map of Africa which is
predominant.
Where we need to. And I saw ourselves, I work with other regional directors, we got together and we said, let's go Malawi. And during that time, the president was Joyce Banda. So we got to her. Yeah, I talked to her. And there was somebody who had been with me in the movement anyway. So it was like, Sheila, come on over. I said, I'm going to camp for 2 weeks in your country. When I come out, especially now that you are doing this law of marriage, you'll be having a good law that will be grounded at community level. I got there and worked. They have 15 paramount chiefs. I got them all and we had workshops. We had whatever. A week before her law was being read in Parliament, I had a meeting with her, with all the regional directors. She came into the room. She thought it was just me and maybe 3 people. She comes in and she had like 30 people with. So she said, well, I said, these are my fellow regional directors, UNFPA, UNICEF, WHO. I said, because this was work that we did. I led it, but we did it together. And I said, this is a proclamation by your chiefs. And she said, all 15 of them, I said, all 15 of them, they even got the smaller chiefs to come to the conferences. As far as they're concerned, nobody in that community is getting married under the age of 18.
Amazing.
And one of the chiefs actually was getting an award about 2 years ago from the United Nations for having stopped 10,000 child marriages.
Really?
Yeah. So that you now see the Sheilas coming out there. Somebody who's saying we're not, and even the men, we have a young one, it's a young guy, he's called Gomani 5. He's a lawyer. He's number 1. In his community, there's nothing like that. So, it was just showing how sometimes some of these harmful practices, you have to take them from the grassroots. Convince them, see what alternatives they can have, and then
don't shout at them.
Work with them. So now Malawi is...
the numbers are really getting better and better.
Child marriages, they're not there anymore. So we went then also to the Butelezi. The chief. Zwelithini.
Before the late...
And we talked about...
Zululand.
We talked about Ukutwala.
What's Ukutwala?
That ceremony where you want a lady, you just lag her and you go to a place. Yeah. And it's as simple as that. When the parents come, they say she's already been spoiled and therefore she's your wife. That's it. So we had to sit down with him and say, and he called us some of the Ngwenyamas and
Neglecting.
but unfortunately he got sick and all. However, it has gone down quite a lot.
Oh.
Yeah, it was outlawed. So
they
it
don't
meant
just pick and choose like that
they don't
anymore.
just pick and choose. So
but
it
the
was
ceremony
really
is still
looking
there.
at our countries to say which ones
the
next one is Ethiopia. But you see, countries like Botswana, there is child marriage, but it's not as it wasn't epidemic. It's something that can be nipped in the bud and So we have to target countries like that. And we saw as a result the epidemic going down. Yeah, because you can imagine an 8-year-old being married to a 50-year-old. Well, HIV like or A transmitted.
What are these case studies? Are they being documented? How's because I don't have the time. No, you don't have to write. You get somebody to write for you.
I'll get somebody to write. But
this Malawi case, the quick Madagascar case, your interaction with Robert Mugabe. I'm already writing the book. The true story.
No, in terms of episodes.
My fellow sex workers.
Do you know that even now he's president, when he meets me, he's like, my fellow sex worker. And I'm thinking, all right. Yeah, but we have those stories. And
because public health leadership.
And my husband used to say to me, Sheila, are you aware that if you die, a library has spent?
No. I
said, but I don't have the time, Kura. Why do I get the time? He said, yesterday, history of Botswana. Can you just give your... I promised him that before I die, I don't know when.
I just finished writing a book. You and I will talk after this.
We'll talk. No, as long as we can. Actually,
not ways of writing. I'm very busy. I made a plan.
Somebody offered to write a book. But the point is, they were saying then I'd have to pay 200,000.
Yeah.
And it was like, no.
It's my data, which is expensive. We're not sharing the...
I'm telling you my data. Every tiny detail. I'm even telling you how I used to get my husband to like, I wanted people to go to do couple counseling.
Yeah.
And the very first time when that happened, I said to my husband, Kana, only you and I can be role models. So Valentine, let's go for couple counseling, have with the newspaper. Hey, and it trended.
Oh.
But people were meeting us. Sheila Letomban. We could tell that they got the message, but you touched wrong. People who are together in a committed relationship, who don't know each other's status, maybe this is the baseline. We need to know it. That way you can then talk and be able to say, how do we ensure that we remain
don't like this,
But I know people are like,
let's come to the modern day. The modern day Botswana. Dinotshe, because there are extreme concerns about the state of our health system. One of the issue of the famous CMS, the famous drug shortages, the facilities. We've got all these extremely fancy facilities. I mean, every time we had visitors, this, but in the end, yes, but it looks like the quality of the health system is going south. With all the work that you've done, and all that, I don't know how you feel about that and what you think needs to happen. Which basics have we lost?
No, I feel bad in the sense that even now, people will meet me. I mean, they know I was one who opened Botswana, Scottish Livingston. They say, but there are no people they care. What do I mean by improve? But I think where we lost it was really maybe the focus on other things rather than the health of the people. Because, it's interesting that when I was, a minister, part of the reason of getting my colleagues to really support money going to health was to show them the reduction in deaths, the reduction in mother-to-child, to give them those statistics, to show them also the reduction in absenteeism.
It affects productivity.
That's right. We no longer have absenteeism. That affected productivity. Now people are working. And indeed, also to show them the now reduced cost of home-based care.
When you look after people, the cost of health goes down.
people now being put on ARV. We no longer had people on home-based care. One time I was called to come and open a home-based care facility. And I delayed for 6 months going there. And actually thought, it's a small village. And I thought somebody, but then the chief there is actually a distant relative of mine. So it was like, no, she has to come. So in the meantime, we rolled out ARVs there. So later when I went, about 8 months later, now let me go and do that healthcare by the facility.
Yes, yeah.
I get there and my car, there was this motor, my car. It was surrounded by these people who were just, patrol.
On the side.
On the side. So I'm thinking, okay, I'm getting to me.
Yeah.
When I got there, part of the introduction, this chief says to me, you see the people who are working by your car? Those are the people who are on home-based care.
Really?
And we called you to come and open our home-based care center. Those, because now you brought ARVs.
ARVs.
Some of them have gone back to Bo Francis Town to work.
The
remaining ones are right there. Those are the ones who are working by you. The only people who are left for home-based care is a child who is, who is deformed, but also an older woman, old woman. Those are the only two. He said, so you did a good job. So now you are opening a center for skills.
Okay. Some training and all that. Yeah.
For training for these people so that at least they are doing something. I found myself, I had no money. I found myself donating money for 2 machines for they should be able to.
At the training center, whatever. Yeah,
training center for that. But I mean, I looked at them and, tears just went down.
That must be very,
and those were the things that I came back and told my colleagues, we are doing a good job. So that we put more money.
So the evidence and the impact was right there.
That's right. I said, right now, if you look at my home-based care budget, it's gone down. So that I think that's where maybe that kind of spirit, that's where we lost it, where now we're focusing on other things. And we forgot that in the ultimate, the health of Botswana is tantamount, is the one that's paramount to productivity, is paramount to any production that we can make, is paramount to any riches. How do you even dig for diamonds when you don't have people who can be able to sort them out? So I think that's where we lost it. But as people say, sometimes these things, they go for an era. Now we are hoping we have a new era because I'm seeing that there is now a renewed energy
to attend to the health system.
And I'm thinking with a little, energy that I have left, I'm going to focus on this renewed energy and support it as much as I can. That's why, these days I appear home quite a few times. There's something to do.
No, that's wonderful.
Because
and they're receptive.
Before we are almost like sort of ignored. If you, it was like they've done that bit. If you came and you advised, it was more like she's ruling from the grave. Kamudima was once told that. Yeah. So now nobody's saying that. So that
welcome.
Until
you're welcome to help because this is your place.
Yes.
Because you mentioned this. There are actually many of you. We are Mepuma P. We've got Dr. Magano. I don't know whether he's still active.
He's still active.
Yeah, but Dr. Mwete, I think she's even been called upon. So we've got super people where we have such talent.
We have. In fact, that was the thing. The talent that was outside, that was being used by other countries, was not being used. And you felt bad. If you look at COVID, I went into the committee that was saying, let's get the countries to have COVID task teams and all that. And I thought, okay, now I'm going to also serve in mine. And I did call here to say, I'm available. I can come and serve in the COVID task team. I met President Ramaphosa, who was saying, look, we need your services. Can you serve in the COVID task team? And I said, no.
You turned him down.
I said, no, I'm going to be called home, so I have to go and serve there.
Yes.
That didn't materialize. That didn't materialize. Before I knew it, I was seeing men in suits who were in the task force were, where are the women in there? Where are the chiefs in there? And that was the task team. It was like, So I remember phoning to say, make an I had called, even the president to say, I'm willing to serve.
Yes.
So later, about 3 weeks later, President Ramaphosa meets me at yeah, he loved. I think it was more like a saved you right. So it was like, okay. Yeah. So that but I do have a feeling if he had been now, maybe calling, it would have materialized.
Yeah,
That's why right now when we said to our president, we can eliminate malaria. And, they said appointment. I mean, somebody else was going to be going in his place for malaria.
This chairmanship.
Yes, for the chairmanship.
Yeah.
But immediately they said, President of Botswana, Mapuma Pens. I said, yeah, that's him. And we said, we are going to work with him. So that's where we are.
That's beautiful. That's beautiful.
And we are, now with the dwindling resources, we are going to really try by all means to see where we can be able to scrounge. How do we get help? Like the malaria, no more UK. If they work well with them, they can be able to sometimes the insecticides, the whatever.
Yeah, they can come here.
Bring over. So it helps that way.
Excellent. Excellent. Now, as you come to an end, I'm hoping that we are now going to almost basic, because I'm now revisiting your profession being a nurse.
Yes.
Obviously, we've got, thousands of nurses in Botswana. But at the same time, let's talk to just general health professionals and the role of a nurse in the system. But I want you, as you respond to that, to the message that you want to give to the health professionals there. There's I think you have a code of, like the doctors, you have a code.
We have a code. We have a code.
Yes. Just speak to them.
We have a code of ethics. We also have the Florence Nightingale Pledge.
Yes.
Yeah. Okay, for my profession as a nurse, is really the one that brought me this far from what I'm seeing. At first, I didn't want to be a nurse. Actually, I didn't want anything in the health sector. But then I was told I wanted to do languages and drama. Remember, I was an actor even at St. Joseph's College. I thought, hey, I'm going Hollywood. So we used to have somebody who was giving the Resekwa said to me, hey, this is a developing country. We don't eat languages. What is French, Latin, we don't eat languages. The only scholarship we have for you is the sciences. I'm not interested in the sciences, Ariela. Your grades are saying you're interested. Physics.
That's how they
So it was like, but then when the scholarship family came for nursing in America, it wasn't even nursing I was looking at. It was like America.
Hey.
I mean, for an 18-year-old America, it was like, I'm going there. So when I got there, though, my thing was still acting, still my, because I like human beings. I really like interacting with people.
You work with
through
people.
Acting. So when they said, how do we help you? I said, show me first the School of Fine and Performing Arts. Once I've seen
at
the university, I went and registered there for electives. And then went and registered for nursing courses and all that. And because of that interaction and the fact that they could tell that I'm really more of a community, public health, they let me take more public health courses.
Okay.
So by the time I graduated, I was also a student at Tulane.
So the seed has been planted.
Yeah, the seed was planted a long time ago. So that I came now with health is made in the community. Hospitals are for repairs.
Gotcha.
Health is made in the community. Hospitals are for repairs. That was my motto.
Wow.
And I worked even with students who say, we start at community first. That way, there'll be very few people in the hospitals. We'll never run out of... So it was basically that. And I found that being versatile as a nurse, I could do that. The nursing profession gave me that impetus because, when you are doing nursing, you are taught, communities, you are taught public health, you are taught epidemiology, you are taught administration. Basically, when you come out... And
leadership, because you...
Leadership. And so basically, when you come out, you are saying, I need to have a niche and I'm going to excel at it. And that's basically what happened. So that later, working with nurses, to me, was very easy. Immediately, I was made a minister. I said to them, I've been working with you. I trained some of you in AIDS care at the time when even the curriculum for nurses in Africa anyway did not include, anything about HIV care. I was already teaching. And in fact, then WHO said, can you in the collaborating center then have more courses for Africa?
Okay, to infuse in other countries.
So that by the time I became minister, I had already a trained cadre of nurses all over, Southern Africa who knew about HIV. And they were now helping me in the ministries as HIV coordinators. Those were all nurses. So that people outside became so proud to see a whole cadre of nurses who are in the forefront on HIV.
Wow.
I had no doctors. The people who had to prescribe, who had to follow patients were the nurse practitioners. So that later I was able to show that, look, without nurses being properly trained, without them being properly retained, as in numeration, whatever, without
looking
them showing appreciation. That's why we established even the awards for nurses. And without them being put in leadership positions, we are not going to have universal access. So that became, therefore, my campaign. In 2000, it was actually in 2020. It was the campaign as a result of the birthday of Florence Nightingale.
Okay.
And one of the guys who is a lord in the House of the Lords said,
in the UK,
we've always talked about this thing. Every time even when we were a minister, you would emphasize that we need nurses because they're the ones who know people at community level. Who know. I would say to them, doctors are trained mostly to treat diseases. So we need to get to them when now there's nothing that we can do, but prevention is better. So he said, I'm willing to join you as a Lord to do the Nursing Now campaign.
Okay.
And because he's a Lord, we were able to be funded by a certain company, Bede Trust. We went around the countries. I've covered right now in the whole world. I think there are probably 8 countries that I have not been
Really?
to. Only 8.
These continents, you've been to all the continents?
I've been to all the continents. And the nurses would be there waiting for me to come and launch the Nursing Now, campaign for them. So, and COVID came, and that's what destroyed our thing, because otherwise we were really in there, and we had involved the ministers to say, let's do. And by that time, when COVID came, if that campaign had gone on, we would have had very few people being killed, dying. Why? Because countries would have had nurses who are well-trained, who are portrayed as leaders, because even during the epidemic, it was the nurses who showed that they are a formidable force that can take care of people under all crisis situations. They were right there. When some people abandoned, they were right there. Some didn't even have the protective gear. But because there is that pledge, the Nightingale pledge, there is also that ethical approach. They were saying, we will care. We know we may be carrying the infection back to our families, but this is the only thing we know. They were able to care. So it's basically that makes me so proud then to be a nurse. That even the time I meet a nurse, even on the street, it's like, Tumelamba, I don't care whether it's in England. And then they look at me like, I say, I'm a nurse too. Oh, okay.
And you think generally...
And I say to them, but don't ask me to take care of a patient because they'll die. I haven't touched a patient in a long time. Yes, that's right. But at least in terms of really knowing what needs to be done at community level, I'm right there.
And Botswana has done relatively well in terms of training of nurses with the IHS and all that, although we've lost them to UK and so forth.
Botswana was the ultimate training paradise for nurses.
Oh.
And the world out there was so proud of the nurses that are trained in Botswana because we have facilities. Right now, training is not going on because much as we have facilities, we now have a shortage of the trainers. But you see, it's something that's happening in other countries. And I've said to them, one thing we can do is collaborate. If you collaborate with Lesotho, with Namibia, with Nigeria, and you say, bring together your trainers. And we're going to have them in here and they'll be able to educate nurses from other countries.
Yes.
We can be able to do that. It's just that right now we're so used to everybody cooking their own little pot that each time when you say collaboration collaborate. People look at you like, you're right. And you say, no,
nothing
that's the
happens.
only way we are going to make it. So we've lost nurses to other countries because they felt like they were not being appreciated.
Yeah.
But the great part about Botswana is that in the ultimate, people want to come back and work in that
People love
country.
this country, yeah.
If we can just improve it, they will come back. During my time, they came back.
Oh.
Remember, I went and got some doctors in Ireland who had been there. And I said to them, come on over, the new hospital coming up. They came back. We had nurses who came back. Granted, when they came back, sometimes they were meeting somebody who say, you know what's one. And they said to me, Minister, you called us. The reception that I get is not nice. Just show them that you can. Exactly. But you see, that impetus, I carried it forth to the point where now in Ghana, and that's something that I'm saying they should teach the rest of Africa. Ghana nurses who are outside, in UK, in USA, every January, they come to Ghana. For 3 days, they are teaching the ones at country level all the skills that they have. Whether it's cardiac massages, whether it's...
the wisdom that they've achieved.
And they made me one of the... At one point, they said, come on over, we are having these workshops, but we want you to be our... the chairperson of the whole thing.
Yes.
They took me to Ghana.
Oh.
Went and, and the reception that I got over there, it was like phenomenal. So, and every day they have workshops for this. And so I had to say to them, I'm hoping you who have remained, you don't think you are so heroic that you don't welcome those who are coming back. Because they know they owe their country something. But they also know that they cannot all be absorbed. Therefore, they want to ensure that when you are here, you also get the skills that they have. And that's what they do. So the thing was, Ghana is my DNA. When I talk to them, I said, no, Africa is
your DNA. Yeah.
The message that we are having, carry it to Botswana, carry it to South Africa, because it's not just Ghana where nurses have moved. It's in other countries. And if they can be able to come back and give back to the country, we will appreciate them. So we are hoping that next year we will have, they were trying to we'll have them do that here. But okay. I've been with them now. This is with the third year of my going there. Every January they say, come on over. Come, to
Ghana.
So it's great. So now I'm in the advisory council.
Okay.
So it's just to say, we want to keep her.
We're now busy, wait.
I know. The great part is back in Anlibone, they're actually now grown. I now have great grandchildren.
Wow.
But my biological children, none of them is married yet. None of them has a child. Only the first one is getting married, I think, October. So, maybe bana. When you say, I was saying to my future daughter-in-law, I said, she was saying, you travel. Exactly. When you start having children, the day you say to me, babysit, I'll be saying to you, yes. There is no way I'll be here. As long as I'll rather lug them with me. Because I used to do that. Her own husband, one time, Malawi, they wanted me. I carried him with me. We'll have a babysitter for you. I can't come. I'm breastfeeding. So I found myself going to Malawi. So I'll have to do that too.
We coming to an end.
It's been a good. It's been a great life. I've really enjoyed myself.
That's
living it. Even the day I go, I'll be saying,
and I wish you another 30 years or so.
No, I wish myself maybe 20. I don't know. Maybe, but not 30 would be too much.
Now, coming to an end, we all have, and you've shared so much insight, so much wisdom. And I hope Botswana and Africa, because that's been really the focus.
Yes.
That we want for you to, in terms of something to leave for the viewers, Is there a book or something that you said, this is where you drank something from that book, or I don't know, whether a podcast or a philosopher, or who would you say, who would you recommend or a book that you recommend that our viewers should have a look?
Well,
if any.
Well, let me, for our viewers, because mostly they will be Botswana. There's going to be a book on President Mogai's fight against HIV. And it's going to be launched on the 19th of August. Now, that's a book that I would recommend everybody to really buy.
Wonderful.
I think it's going to be a real motivator. It's going to inspire a lot of people. We are in there. Bo Sheila Dinotshe Tlou, Joy Kumate, all the actors, even including people who are living with HIV. So it will be great for Botswana to read about that, especially the young Botswana, to just see where we came from and the reason why we still are not giving up in where we are going. You know, we've seen the devastation where we had no hope. We saw where we now had hope, and we're saying we still can continue with that hope, because if we keep it alive, we will eliminate. So it's basically that. And we're thinking it cannot be just with HIV. It can be with any other epidemic that comes, any pandemic that comes. But the most important thing that we need is proper leadership, proper political will and commitment, putting money where it is needed most.
Where your mouths are, yes.
Lack of corruption, zero tolerance for corruption. That is saying we want money, the resources to be channeled where they are most needed. And they should have an impact. And most important, we need where there is a collaborative approach where we work within ourselves as a country. We work with our communities, with our chiefs, with our young people. They are our future. They are the Facebook people. They are the Instagram people. They know more a lot.
Absolutely,
a lot more
than
about,
we do. Yeah.
And they can solve problems like that, where sometimes it took us long time
yes, to solve.
Be able. That's right. So we need to have them in and really engage them, because our young people are not that well engaged. Without jobs, they cannot be that properly engaged. We need to ensure that they're in there and they know that this, in the ultimate, is their country. Yeah. So basically, that's that.
That's so powerful. That's so powerful, especially touching on the young people, because we all feel for them.
Yes.
I also do not see this has been so fantastic. I really appreciate your time. And I know that we met at the thing and chatted on WhatsApp till we ended up here, and I really, really, really feel blessed to have you here.
Thank you very much. But I'm still available.
Yes.
When you think of writing that book, we can write it together, because there is a lot. There is a lot, you know, in here. That can come out.
Something solid. Something solid is going to come out. Yeah, so
it will be great.
So you and I have this deal that we have to come back to our viewers and say, where's the book?
Where's the book? That's right.
No, thank you very much.
It will be
really
great. Thank you so much. And I have all the pictures. I mean, unlike Sir President Mogai, mine cover the rest of the world. You can imagine Thailand with Netanyahu and really working with on HIV with them. Yeah, so it's
and testimonials all over, from the Lords to universities in the US, everywhere.
From the House of Lords, yes. Yeah, where I would go in, you know, this Lord Crisp, he said, what? We're having a session, come on over. And then he says, no, I'll get you a seat. They just think you are a new Lord. I'm thinking, a new Lord, a black one? I don't think so. So indeed, I go and find a seat. There is a mic hanging here. And they're debating. At one point, they were debating Brexit. So, you know, after an hour, I'm listening to them. After an hour, I go like, Nigel, I'm tired of Brexit. Let's get outside.
He's very engaged.
So we come outside. Nigel, during the break, Nigel, who is your friend? He's a new Lord. Really?
Self-appointed.
It was good.
But thank you very much. You can see that Nala was really but we really appreciate you.
It's easy for me. Next time,
We'll do exactly that.
Really.
GrowthWell family, thank you very much. Hope you had good time. And please remember to subscribe and share these wonderful stories, this wonderful wisdom. And we'll see you next time. Thank you.